But essentially, autoimmunity and mycotoxins and how it occurs and how can you help your patient? And again, all the information here is to educate people. I'm going to hit a milestone in birthdays, and I want to impart to you what I've learned over the last 33 years. And again, I'm evidence-based. I've published over 100 studies. I have chapters in medical textbooks. I've taught at 4 different universities and lectured there. So that's what makes me an expert versus all these people on the internet with, I don't know where they got their particular degree, but they call themselves doctor, and they have all this advice with no evidence. No, everything I present is with evidence. So this we know already, that molds are always there when there's water damage in an indoor space, be it a home, the gym, your workplace, schools, universities, libraries, etc. And when molds are there, because of water damage, they're always producing mycotoxins. And the exposure is far greater than has been thought previously. In the United States, it's 85% of buildings have had past water damage, while 43, half that amount, have current water damage. So what was this article that was published 30 years ago, 1993, in the New England Journal of Medicine, said it estimated at any one time 10 to 25 million workers in 800,000 to 1.2 million commercial buildings in the US will have symptoms typical of SBS. In the early 90s, it was called sick building syndrome. So let me impart to you a little bit about the immune system. The immune system has a very complex task. It has to recognize any cell and tissue in our body and ignore it. Pretend it's fine. No, not pretend, but just leave it alone. And it has to attack any and all foreign something that gets in our body, what we call in medicine xenobiotics. That's X-E-N-O biotics. Bacteria, viruses, toxins, chemicals, everything like that. And it has to do that and be ready to do it in perfect coordination, 24 hours a day, 7 days a week, all your life, as long as you live. Our immune system can do this, and it can, while recognizing and eliminating billions of microorganisms, chemicals, and toxins we come into contact with. And again, it's what the immune system is there for. So what is autoimmunity? We just talked immunity. What is that? Now, autoimmunity is when the immune system attacks and destroys our own tissues, organs, glands, hormones, enzymes. Okay, it turns against us. It gets confused and turns against us. What's happening with autoimmune disease? It's an epidemic. The frequency of autoimmune disease in the United States over the past 30 years has been rising at 8.8% average annually. That's an astounding increase. And as you can see, I always put the references at the bottom. There's many more, but I always put at least one reference. In a recent review of the CHIP on this issue of this growth or increase in autoimmune diseases, researchers summarize the situation as follows. Taken together, the number of people suffering from autoimmune diseases is 24 to 50 million Americans, 16% of the US population. And to put it in perspective, autoimmune disease prevalence equals heart disease and cancer combined. And we're not going to even mention that HLA-DR test that, according to the Shoemaker crowd, Nathan crowd and all that, they think 25% of the population has that. So look at this here. This is evidence. Okay. Now, what's causing the increase? Dr. Noel Rose, who was head of the Autoimmune Disease Research Center at Johns Hopkins University School of Medicine, said there has to be some kind of environmental exposure, because genetics, which accounts for a certain part of it, doesn't change that fast. Environmental triggers will be the next wave of research. And he said that many years ago, and he was right. For example, we evolved with our microbiome, okay? And our microbiome is where 80% of our immune system is. And those bacteria which reside in our gut, and which under normal circumstances consist of over 500 beneficial species, and they exist in harmony. I get questions all the time. Well, what about imbalancing the microbiome if you take Sporanox? Or forget that. However, whereas once we acquired such a microbiome in a natural way, which means through natural childbirth, meaning that the first bacteria in the babies in the newborn's mouth were mother's bacteria, 32% are now born via C-section, cesarean section. What does that mean? The first bacteria in baby's mouth are from instruments and hospital personnel, not from mom. The other part is the indiscriminate use of antibiotics causing defects in our microbiome. I see patients regularly who have been on a year, 2 years of intravenous antibiotics and multiple antibiotics for Lyme, Babesia, Bartonella, this, that, and the other. Again, folks, it's a bacteria. Can you imagine having to take 2 years of IV to clear a strep throat? No. Well, we'll get to that in a minute. As far as the gut is concerned, I published a review article a few years ago, and it was published in Autoimmune, the journal Autoimmune Diseases, and I reviewed the microbiome and all that. So if anybody wants a copy, let me know. Now, what's the main symptom? Now, at present, we have over 100 recognized autoimmune diseases, okay? And these include inflammatory bowel disease, multiple sclerosis, rheumatoid arthritis, lupus, etc. All of these have high comorbidity with anxiety, depression, pain. All of these serve to induce fatigue, okay? So 98% of individuals with autoimmune disease report that they suffer from fatigue. So it's the #1 symptom. And it's also the #1 symptom for mycotoxicosis, when you suffer from the mycotoxins from molds. And then in this study that you can see down at the bottom, which was published 4 years ago, and notice the third author is Dr. Noel Rose, who I mentioned briefly before. Over 2/3 of respondents reported their fatigue was profound, debilitating, and prevented them from completing just simple everyday tasks. That's autoimmunity for you. Here's a well-established connection: Hashimoto's, thyroiditis, and mycotoxins. Millions of people struggle with Hashimoto's. It's an autoimmune thyroid disease. They eat normal amounts of food, exercise regularly, yet they keep gaining weight. Their thyroid levels are difficult to treat, and this is because the cause are the mycotoxins. It's not the thyroid. It's the effect of mycotoxins on the thyroid. Once the treatment for mycotoxins is complete, the Hashimoto's fades away. So, and this is, let me show you a study. This is a patients with a history of mycotoxins and having chronic fatigue, cognitive disorder, and different kinds of hypothyroid symptoms, despite treatment with levothyroxine. The most important factor in thyroid hormone regulations are 3 deiodinase enzymes. They're called 1, 2, and 3. Great. In particular, the second one regulates the activities of the thyroid hormone action by metabolizing the precursor molecule T4 that is secreted by the thyroid gland into biologically active molecule T3. Okay, so then what else? Oxidative stress, which it has been written about in hundreds, if not thousands, of studies that mycotoxins cause oxidative stress. This also impacts negatively on various hormonal influences, causing antioxidant imbalance and impairing the function of the deiodinase enzymes. For example, oxidative stress reduces the capacity of this. Remember, number 2 was the most important. It reduces the capacity of number 2 to convert thyroxine, T4, into its biological form, active form, T3, which is what it stops it. So here you are, you're trying to treat a patient with thyroid imbalance and nothing's working. Well, then you know. So these patients presented with normal function of thyroid with required treatment with T4 with normal thyroid stimulating hormone levels, free T4 and free T3 values in blood, but still with symptoms, okay? Once the treatment for mycotoxins was complete, normal thyroid function returned with no symptoms. Let's talk about an autoimmune disease that affects younger people, young adults. It's multiple sclerosis. And what we know is that gliotoxin is part of that problem. This was demonstrated very clearly by a study done at Rutgers University School of Medicine. It's in many of my previous webinars on the brain. So what is gliotoxin? It's the major and most potent mycotoxins that's secreted by Aspergillus fumigatus, it's capable of injuring and killing brain cells such as microglial cells, astrocytes, and oligodendrocytes. Now, for those of you who know your medicine, what do oligodendrocytes produce? What do they produce in the brain? They produce myelin. You know how the brain is gray matter and white matter? Myelin is the white matter. And this mycotoxin kills these oligodendrocytes, causing loss of myelin called demyelination. So there are studies, and I've participated in several, showing that it leads to what is called CIDP, chronic inflammatory demyelinating polyneuropathy. Okay, so studies in patients with MS, and MS is an autoimmune disorder, and it's an autoimmune disorder of the central nervous system, suggested that these mycotoxins are the initiators or aggravators of MS. So here is evidence that mycotoxins can cause autoimmunity of the nervous system. In one study of 119 patients, 83% presented with peripheral neuropathy, in other words, neuropathy in the arms and legs, numbness, tingling, tremors, and muscle weakness in the arms and legs. Autoantibodies against myelin basic protein, myelin-associated glycoprotein, ganglioside GM1, sulfatide, myelin, oligodendrocyte glycoprotein, and all these others were found in all these patients. So in this same study, the mycotoxins had been implicated in the production of ANA, anti-nuclear autoantibodies, that we all are familiar with, and anti-myelin antibodies against the nervous system, both central and peripheral, and against an antibody against smooth muscle, anti-smooth muscle antibodies. The most prevalent symptom was fatigue. Remember what I told you a few slides back about fatigue. This is a study that I participated in. So In autoimmune diseases, continuing on multiple sclerosis, inflammatory processes, in other words, neuroinflammation in multiple sclerosis, this is the key mechanism to the pathophysiology. And the pathophysiology is that gliotoxin has been shown to affect and damage microglial astrocytes and oligodendrocytes. And this was published just 3 years ago. So let's take let's go to the gut. Strong evidence is provided by not a well-designed, but several well-designed studies showing that the mycotoxin deoxynivalenol has the potential to induce, in other words, to trigger the onset of inflammatory bowel disease and ulcerative colitis. This has been all pretty well established. Now I want to tell you its history and pictures. Here's a young woman, about 30, and this is her on the left. And she writes under it, "This picture is scary, LOL. I look like an addict or something." This is a few weeks after being treated for Lyme and before I knew I had mold issues. And the next picture shows her smiling and happy. "I would never dream a year ago I would be well enough to be taking my girls by myself for a day at the beach and having the energy for it all. No more fatigue." Very critical. Talk about SIBO, okay? So here is on the left, pre-itraconazole treatment for mold, and on the right, after, okay? The first morning I've woken up with just about completely flat stomach with no bloating. So there you go. This is pictures, evidence in pictures, not medical scientific evidence, but evidence from patients, anecdotes. Autism and mycotoxins. Mycotoxins in autistic toddlers eventually caused autoimmune disease, including systemic lupus erythematosus. This was a study that was published also, as you can see below. What about, postural orthostatic tachycardia syndrome, POTS, and chronic fatigue syndrome? Well, they too are caused by mycotoxins. And here is the studies showing that, okay? Then rheumatoid arthritis. So deoxynivalenol and ochratoxin increased the susceptibility to develop rheumatoid arthritis. So it made it easier for patients who have these to develop rheumatoid arthritis. Then on those who had the disease already and then were exposed to molds and mycotoxins, they increased the severity, the clinical severity of rheumatoid arthritis, and they elevated levels of interleukin-1 beta as well as interleukin-6. And these were found in the joints of these inflamed joints. There's a quick question here. Do mycotoxins transmit from mother to child? Yes, they do. I gave a webinar on mother and children the first 1,000 days, which if you go to the MyMycoLab website and click on video, all the webinars will come up. So now, here's another one. If you remember these rheumatoid arthritis, look at this man's finger, his ring finger. You see the inflammation and you see his arm, that's psoriasis, and this is known as psoriatic arthritis, two autoimmune disorders together. And so this is his chest and abdomen. You still can see the finger, swollen joint, painful. Here is 2 months of treatment. It's fading away. 6 months after treatment, what happens? Basically, it's gone. Treatment, Sporanox. Here's the mom of a doctor, a well-known doctor. I'm not going to mention his name. Here was her test. You see all the red on the left, IgG antibodies. We're all in the red. IgE was not so bad. But you can see how severe she had, how much, because this is a test that tests the quantity of these in your body, okay? It's a quantitative test. Now, here she is on the left before, and on the right after. Obviously, she did these herself on her cell phone. But here's the evidence. Here's the tests. You see no more red, except for one, deoxynivalenol. Now, just so you understand antibodies, because a lot of people think antibodies are the same. Okay, if I had some disease when I was a kid, I still have antibodies for, and a good example is myself. I had chickenpox when I was a kid. Currently, I have chickenpox antibodies in my system. And there's 4 kinds of pathogens: bacteria, viruses, pathogenic fungi, and parasites. Pathogenic fungi are like fungi that cause pulmonary disorders such as pulmonary aspergillosis. And we develop antibodies to these after an exposure in infection, okay? Now, these 4 are all living. They have cell walls, etc. Antibodies to these mean at some time in the past, you had this. Toxins, however, are not alive. They don't have cell walls. Mercury is not a living thing, nor does it have a cell wall. Antibodies to toxins indicate current immune reaction, not something that happened way back when. Once the toxins are gone from the body, the antibody reaction fades away. You see what I mean? 6 months later, they fade away. So the key to solving medical problems caused by toxins is detect, remove, repair. Detect the cause, remove the cause, repair the damage it left. It's what your mechanic does. How do you treat it? You apply the first rule of toxicology. Get the patient away from the toxin, or the toxin away from the patient. They can no longer be working in a moldy environment, living in a moldy environment, going to a moldy environment. A person's health cannot be restored if they continue to be exposed, no matter what the treatment. You have to minimize environmental exposure, such as pesticides, volatile organic compounds, which for the most part are neurotoxic. There's actually I have a textbook on volatile organic compounds, because as part of my training as a toxicologist. Avoid, like the Dickens, processed foods, artificial sweetener, artificial flavorings, artificial colorings, artificial preservatives, all those things out. EMF exposure is, if you can, because it'll aggravate the symptoms. Now, 80% of the immune system is in the gut. So this is the first place you begin. The main component will be diet, supplements, and probiotics, and use spore-forming bacilli for probiotics. I always recommend Megaspore Biotic. They're very good. Diet, try gluten-free for 90 days. And by all means, avoid dairy, sugar, and soy. I want to mention deoxynivalenol because people read on and go to Dr. Google for just about everything in their life. I go to Google too. But the point is that they say, oh, it's from grains, etc. No, it's not. Here, if you see about halfway down the first paragraph, it says in the second sentence, a 2-year-old child with a body weight of 28.2 pounds would have to consume 4.7 ounces of oat flakes, corresponding to about 38.8 ounces of ready-to-eat or oatmeal, or 3.2 ounces of wheat, corresponding to 4.7 ounces of bread, approximately 3.5 slices, all at one time, all smelling awful, tasting awful. In an adult weighing 170 pounds, you would have to, well, you can read, it's 14 pounds at one time of oatmeal, or 20 slices of bread. And again, these are all rancid, in order to get to the toxic level that is clearly seen when you are in the testing for indoor air levels, like what you saw. In other words, here, this is deoxynivalenol. Here, no, this person did not eat all these horrendous amounts of bread or oatmeal. Okay, next, symptoms. Is it mycotoxins? Is it Lyme's? Is it Babesia, Bartonella? You see all the symptoms. They're very similar, aren't they? Well, of course, yes, they are. And then here's an article that I published 4 years ago now, in July 2019, and Lyme disease and mycotoxicosis. How to differentiate, how to tell if your patient is really Lyme or really mycotoxins, or could that patient have both? And the answer is yes, the patient can have both. So there's, just to kind of tell you the diagnostic issues between Lyme disease and mycotoxins, over 3 million Lyme tests are ordered annually. Obviously, there's not 3 million people that develop Lyme every year, okay? Patients can have a positive Lyme test due to what? Cross-reactivity to mycotoxins or previously treated Lyme disease. And there's some healthcare practitioners who, if a patient says, I have chronic fatigue syndrome or fibromyalgia, they're going to order, but they don't look at which Lyme test. They just say, oh, this one. Many clinicians look for co-infections with Babesia parkinella, but fail to look for mycotoxins. And it was discussed in this study below. A very common mistake I see regularly: healthcare practitioners who treat the lab results and not the patient. Okay, which means they don't say, did you have a fever and this and that and the other? Oh, look, the test came out. It says positive for Bartonella or Babesia or ehrlichiosis or whatever. Oh, therefore we have to treat you. And they don't take a look, and they don't know about cross-reactivity. So why is it difficult to really know this? Because there's overlapping symptoms. So the importance of using the correct methodology in the laboratory is essential. Use the multi-peptide ELISA test rather than Western blot. Why? In Lyme disease, it detects different life cycles. It excludes antibodies against unrelated spirochetes, the type of bacteria that Lyme is. It detects antibodies against Borrelia subspecies, and it detects antibodies against Babesia and Ehrlichia. And these results can be used for follow-up treatment. So you can see on the left, and this is the under Western blot, which is in red letters. That's what Western blot does. And in blue is what the multi-peptide ELISA test does. This is based on serum samples, blood serum samples from the CDC, 200 specimens from patients with documented Lyme disease, and more than 200 samples from healthy controls. The sensitivity of the multi-peptide test was over 80%, and the specificity was more than 95%. Now, that's the kind of test you want, okay? So, what you want to do is use the correct test, and the lab is Immunosciences Lab, and they're in Los Angeles, California. Excellent lab. I've used them for decades. And by the way, this test is the only patented test for Lyme in the United States. The other labs who do this test, and you know the names of those labs, don't have a patent. This one, Immunoscience, does. And look at how much better it is, and it's cheaper than the other labs. Okay, so the specificity and sensitivity of recent serology assays for the presence of IgG and IgE antibodies to mycotoxins in the blood are very high. So what are the mycotoxins? They come from penicillium. Remember, there's over 300 species of penicillium. There's hundreds of species of each one of these. So when I get a question like, they found Alternaria in the bedroom, well, which of the 500 species of Alternaria did they find? Oh, okay. Aspergillus, same. Stachybotrys, over 500. Calosporium. So these are essentially the 12 mycotoxins that you test for. And you get both the IgG, which shows a toxic reaction, and an IgE, which is a mast cell activator. What's important about that is because if it's a mast cell activator, if they're very positive, that can throw the patient into mast cell activation syndrome. And if you really want to know how to diagnose that and how to treat it, I gave a webinar on mast cell activation syndrome, and it's the same webinar I gave in a class at a medical school in California. Panel of 24 test results with significant accuracy, precision, and specificity, and that's MyMycoLab.com. This test was originally developed about 30 years ago, and then the lab shut down, and then it was reopened by different owners as MyMycoLab. I'm their medical advisor. It's not my lab. Okay, so here's the latest study. And if you look at the very bottom, it says in the last line, 2022, October 25. So it's 5 months ago. The variability, what this showed is the variability of mycotoxin concentrations in urine, and its volume based on daily intake demands urine sampling at different time points during the day. So if you send in a urine sample, first of all, it's what from the food the person ate. And then the inter-individual comparison of mycotoxins is very challenging because a lot of different factors such as gender, age, diet, muscle mass can influence creatinine secretion. So what did the study say about antibody tests? The ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. And this is MyMycoLab's test. More about treatment. First and foremost, get the patient away from the toxin and the toxin away from the patient. And then, yes, there's a lot of buildings, a lot of places that have molds, but you can remediate that. And once you've got it remediated, that will help the patient. So the second thing you do in the treatment is build back up the immune system while giving an antifungal. Okay. Next, here's a study on chronic rhinosinusitis, and those chronic sinus problems done at the Mayo. Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery of the Mayo, published this study 1999, 24 years ago. Yet people don't read. 210 patients, 96 had mold grow out on plates. Treatment, intranasal amphotericin B spray, okay? Reduced the inflammatory mucosal thickening on both CT scan and endoscopy, where you go up into the nasal sinuses and take a look yourself. So, wait, here. And let's talk about the treatment itraconazole. And this is from a study published 5 years ago, 6 years ago now. Itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It has been in clinical use for 35 years. Well, it's over 35. It's now 36 years, 41 years with an established safety record. And then also, there's so many out there, they give people fluconazole, diflucan. Oh, it's to treat the mold. No. There's two kinds of molds, single cell and multicellular molds. Single cell molds are yeasts. Multicellular molds are Aspergillus, Stachybotrys, Penicillium, et cetera, et cetera, et cetera. Diflucan only kills yeast, doesn't touch the rest, the multicellular. Treatment for multicellular not only gets rid, in itraconazole, gets rid of all these Aspergillus, Stachybotrys, et cetera, kills them, but also it kills the yeast. So it's probably gotten from some sort of I don't know what. Anyway, we talked about that. So let's look at what studies on binders show. So binders rely on the absorption of mycotoxins from the gut, and it prevents them. It's supposed to prevent it from getting into the bloodstream. And these are all these different ones, clays, activated charcoal, bentonite, blah, blah. They are effective in neutralizing aflatoxin, a rare mycotoxin. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. And if you think that by giving them separate from the time you eat and all that makes a difference, there isn't a single study that says that happens. Also, this is the only study in humans. All right. What about ERMI? Get this all the time. We did an ERMI test and the score was XYZ. You're not supposed to be using ERMI. This was published 10 years ago. But for some odd reason, people rely on it. It shouldn't be relied upon. And there's, if you want more information, as in on this, I have it all. So don't use the ERMI test, please. So this is a common email I get from patients. It doesn't necessarily have to be 5 naturopathic. I've had five this, 5 that, 5 the other. And this includes MDs and DOs and everything else. They prescribed herbs, binders, and cholestyramine. These things just made me feel worse. How do you know anyone that can help me? And most of these people have taken these things for 2, 3, 4 or more years. And now here's a professional. This is a healthcare professional who wrote to me in an email that I'm aware of the courses given by urine labs. Much of the information, these courses are not supported in medical science, and this makes it very difficult to get traditional medicine to get behind molds and mycotoxins, as well as to have valid codes so that insurance companies pay for testing and treatment. And Shoemaker is now promoting a test that has no validity in medicine, the VCS test. I think it's a visual thing. Others, such as labs that perform urine tests, do not give results that have anything to do with indoor environmental exposure to molds. And he sent me a study. Many of these so-called experts who give these courses at these urine summits and whatnot have never published anything in peer-reviewed journals nor lectured at medical universities. Their expertise lies in marketing themselves on the internet and getting paid by urine labs. This is a patient. I want to personally thank you for your time, etc. It has been a while since I talked to the subject matter expert who has both the level of experience and backed up by science. I salute your work, blah, blah, but here's the important part. It's not easy. It is not easy to find accurate help in a sea of misleading information led by those who mainly take advantage of the sick and the desperate. And that's so true. Unfortunately, I've been doing this for over 30 years. I know what this patient said. Now, this is another healthcare practitioner, and your antibody testing, it's not mine, likely saved my and my son's life. Unbeknownst to us, we were in a water-damaged building and very sick. My son had developed seizures, fatigue, and severe body pain, had to drop out of college. And I was so tired and so much body pain, I thought I would have to quit work that I'm passionate about. Your test changed the course of our lives forever. It has also helped countless of my patients, including some with breast implants that were moldy. Why? Because last month I gave a webinar on breast implant illness. And it's because inside of these breast implants, whether they're saline or silicone, there's mold. This is from a doctor. He's a professor at a medical school. And as a follow-up, he told me, I told you that after moving out of the moldy home and taking itraconazole and your recommended nutraceuticals, my eyes were better. I saw the ophthalmologist Friday. Everything is back to normal. Virtually all is back to normal by examination. Why? Because he developed a corneal problem and developed blurred vision from the mycotoxins affecting his eyes. And I wrote a study on that years ago, me and other doctors, a group of us. So if you want copies of the studies, if you want some questions, if you have any situation that needs clarifying in the sense of testing or so forth and so on, and if you want, most importantly, the immune questionnaire is something I developed 30 some odd years ago. And it helps you and the patient by focusing, is this really something that is, how to deal with this in a sense that you, by filling out the questionnaire, if it's not or if it is mold. And a question here, Scott. Nice to hear from you. It's been a while, but always welcome. IgE versus IgG. So, using them to determine current versus past environmental and mycotoxin exposure. It depends on the individual. Why? Individual results. Why? Because everyone's immune system is unique and different. So you can't give a blanket, this is this and that is that. If you have some of this and then some of that, that might have an effect on whether it was one of the 3 points. It's from previous exposure. Somebody lived in a house 2-3 years ago with a lot of mold. They got sick there and they moved. Second, they're living in a moldy place. In the first case, that person can be colonized by mold. So are they currently exposed inside? Yes, they are. Because they're colonized, just like that study by Dr. Ponikow, the Mayo Clinic, 24 years ago showed. Okay. So in the testing, the IgE is more of a mastocyte activator. Mastocytes are cells that are filled with small bubbles, if you wish. And these small bubbles, once they're released, contain things like heparin and histamine, et cetera, if it's the typical allergic reaction. When it's the antibody is from a mycotoxin, it causes the secretion of inflammatory cytokines. And that's being looked at very carefully in a lot of studies that have been published from Tufts University School of Medicine. So how quickly do your antibodies appear after mycotoxin exposure? 20 days. Okay. So 20 days after, is when you know if there's exposure. Most people don't even know they've been exposed until they get sick, and it's much later. And so say you're exposed to 5 mycotoxins. Remember, one mold produces many mycotoxins, and one mycotoxin can come from many molds. So having said that, once you get the antibody testing, it's 20 days or longer. So if they were exposed on, say, January 1st, just as a good example, by January 21, they'll have the antibodies. And how quickly do each appear is that 20 days. And how long does it take to go away? Oh, it takes, in most of my patients, more than 15,000 of treatment that's been published in many studies, it's 6 months. In 6 months, you have the problem solved. The patient is well. As a matter of fact, my first question to each patient is a very direct one. How do you feel? I don't say, how are you? How's it going? Or anything like that. I say, how do you feel? And when they say, I feel pretty good, that's when I tell them to go forth and multiply. And that's it. Now, this is from a doctor, and a medical doctor who's a friend of mine. And this is, in a nutshell, would you suggest that any patient with autoimmune disease should be tested for mycotoxins? Absolutely. And any patient who has mycotoxins should be tested for autoimmune disorder. And by the way, the lab that I mentioned for Lyme, the Immunosciences Laboratory, has a great autoimmune panel, again, and it doesn't cost that much. I have another question about breast implant illness. And this person not only has breast implants illness, but also water damage in their home. If you want the lecture, just go to MyMycoLab.com. At the top, click on where it says video, and it pulls up all these. Or just email me, and I can send to you. And any other questions, folks? Here we go. No. Scott, maybe you weren't here, but let me take you back to a patient that I showed earlier. This is a lady with psoriasis, obvious. This was her test results, her mycotoxin test results, and you can see how the IgG were very, very high levels and positive. Here is the before and after picture. The left one, obviously, when she had it, and the right one is when it went away. And to give you an idea of the results, here is 6 months later. So you can see that it's much reduced. Or if you want, what I can do is take you back and just look at it visually. And here you can look at it this way. So it took 6 months, and that's what it takes in general for these antibodies to go away, because these are not antibodies to pathogens. These are antibodies to toxins. What about mycotoxin oxalates? Do I see any relationship with autism? I do not. Thank you for the compliment, Dr. Singh. So please let me know your questions here, because we're about to wrap up. And regarding autism, I gave a webinar on autism, and I treat autistic children. Today I saw one, yesterday I saw one, the day before. Why? Because of social media and mothers talking to other mothers. I shouldn't say mothers, but mothers and fathers talking to parents, talking to other parents on social media. Why? Because we get these kids well. You treat the mycotoxins, guess what happens to the brain? They get better. I treat the patient, not the lab test. So if the patient tells me they're great, they're doing fine, they're back to where they were, I stop treatment. Because in the 15,000+ patients that I've seen, it's very rare that after 6 months or so treatment, that there's one that says, I'm great, I feel super, and then 2 months later, they're back and say, something happened, I feel bad again, unless it's been re-exposure. And another one, remediated down to the studs and felt better, still in the same house. Now I have MCAS cell reaction. So no, I don't know what your mycotoxin levels are. I don't know neither the IgG nor the IgE. How do you modify the treatment for patients that are unable to get away from the water damaged building or homes? So if a patient has, for example, is ill because of radiation, and you stay in the radiation, they're not going to get better. Or let's pretend it's not radiation, which is invisible. But let's say it's mercury, and they're sick with mercury poisoning, and they still work around mercury. They're not going to get well. So there is no alternative way to treat it. What is the length of treatment for Sporanox? Again, I encourage you to go to the MyMycoLab website, click on video. I gave a webinar a month ago on treatment, go through everything, so it's all there. But it takes about 6 months. And it's not only Sporanox, please. It's a set of different things, like I talked to you about the gut and how important it is to get that back up at speed, and that I use spore-forming bacilli. That's just one example. There's too many examples to give here in an hour in this webinar, and I've already did the discussion. So if the mycotoxin exposure occurred years ago, but not treated in the past, and no current exposure, would IgG still be positive? My big question would be, again, I don't treat a test. I would first ask the patient, how do you feel? If they say, I feel terrible, I've got fatigue and all the symptoms we talked about in this webinar, then yes, I would test them. If they're saying, no, I'm fine. Yeah, I was exposed. I spent a month in a cabin when I was a kid for summer camp, and I think it was moldy. And now they're, I don't know, what, 20, 30 years later, and they're feeling fine. Why would you order a lab test for a patient? So remember, it's important to discuss things with the patient and ask them a lot of questions. Have I seen mycotoxins associated with Crohn's? Yes, because as I showed you, IBD, inflammatory bowel disease, includes Crohn's. A few more minutes for anyone to, let me also go and give the screen with the, where is it? With my email. There we go. So just let me know if you have any more questions. We'll probably be shutting this down in a couple of minutes. and I hope you liked it. Is the itraconazole treating biofilm in organs and guts? First of all, you need to read about mycotoxins in the gut. Would you believe that the gut microbiome actually has an effect on mycotoxins by a method known as oxidation, and it reduces the toxicity of mycotoxins? So Dr. Weinstock, professor of gastroenterology at Washington University School of Medicine in St. Louis, Missouri, and I published a study discussing that, and you're welcome to have a copy of it. But you're not, if you start treating, well, I'm going to give this for that and that for this and this for that, you're going to cause some polypharmacy, and that's not helpful to the patient. So the itraconazole takes care of both the biofilm and where is the first place that mycotoxins attack? It's the brain. Itraconazole crosses the blood-brain barrier. That's why it's the treatment. And you can go back 30 years, and most of the studies consistently say the same thing about that. And by the way, I gave a webinar, 2 webinars, one on brain part 1, children and young adults, and brain part 2. Brain part 2 was in older adults, Parkinson's disease, amyotrophic lateral sclerosis, and Alzheimer's disease. Did you know that studies are showing, current studies are showing that in amyotrophic lateral sclerosis, 5 to 10% is genetic. The rest is all due to mycotoxins. All right. Here's another question. Does IgE moderate in the red show current mold in my living area or past stays in hotels and other sites? Well, if you go to a hotel and you're there for a couple of days, a weekend, it's not enough time to build antibodies unless it's very, very, very moldy, and you slept on moldy sheets with moldy pillowcases and walked on moldy carpeting and all that kind of stuff. A couple of days at a motel is not going to affect you. All righty. As I hope you've all been helped with this. I think that it's important for you to always ask questions. Use all my my data, and any studies you want, please email me. Have a good night and a great rest of the week.